Hi, my name is Karla Castro-Soto, and I'm the Associate Vice President of Helpline Services at Partnership to End Addiction. Today we're talking about two substances that are making waves in the medical community, ketamine and esketamine. Before we get started, just a reminder that subscribing to our YouTube channel by ringing the bell is a great way to stay connected with our community and keep up to date on our latest educational resources from both parents and professionals with lived experience and valuable expertise. What exactly is ketamine? Ketamine is a medication that was originally developed in the 1960s and used primarily as an anesthetic during surgery. It's known for its fast-acting and powerful effects, which make it quite different from many other anesthetics out there. Let's introduce esketamine into the conversation. Esketamine is a derivative of ketamine. This refined version of ketamine has been approved by the FDA, specifically for use with treatment-resistant depression and major depressive disorder with suicidal thoughts. As a nasal spray, it is marketed under the brand name Spravato and requires a prescription as well as monitoring by one's healthcare provider. So why is esketamine considered an important breakthrough? For individuals with treatment-resistant depression or major depressive disorder with suicidal thoughts, traditional antidepressants do not work. Esketamine, however, can provide rapid relief from depressive symptoms, sometimes within hours. This is a stark contrast to traditional treatments that can take weeks or even months to take effect. Perhaps you're wondering, how do ketamine and esketamine differ? While both affect special receptors in the brain, known as NMDA, esketamine is thought to be more potent on a per milligram basis than ketamine, which means it may be effective at lower doses. Esketamine is specifically FDA approved for depression, while ketamine is more used broadly in off-label applications, including both mental health and pain management. Now, let's talk about ketamine therapy. Similar to esketamine, ketamine has found a new role in mental health treatment, emerging as a promising option for conditions like depression, anxiety, and PTSD. It's important to note, though, that ketamine is not FDA approved for any mental health conditions. Ketamine therapy is offered in various clinical settings, often in specialized clinics that focus on mental health and pain management. Ketamine therapy typically involves administering a low dose of ketamine, either through an intravenous IV infusion, intranasal spray, or oral lozenge. The process typically involves a thorough medical evaluation to determine if a patient is a suitable candidate. Once approved, the patient undergoes a series of treatment sessions which are closely monitored by healthcare professionals. The therapy sessions can range from 40 minutes to several hours, depending on method of administration and the patient's response. This structured and supervised approach ensures the safety and effectiveness of the treatment, allowing for any necessary adjustments to be made in real time. Treatment can be expensive and most often not covered by insurance. There are also mail-order programs for do-it-yourself ketamine administration. While these programs can be convenient and less costly, there are significant concerns about safety with this approach. Let's shift gears a bit and talk about ketamine's role in pain management. Ketamine has been used to treat both acute and chronic pain, although more research is needed. Ketamine's unique action in the brain helps to interrupt pain signals and reduce sensitization, providing relief where other pain treatments might fail. For acute pain, such as pain following surgery or traumatic injury, ketamine can provide effective relief and is often used in emergency settings. Its ability to act quickly makes it valuable in situations where immediate pain relief is necessary. For chronic pain conditions such as fibromyalgia, complex regional pain syndrome, CRPS, and certain neuropathic pains, ketamine has shown promise as well, although research on ketamine for chronic pain is in its infancy stage. Providers and patients need to discuss who it might be helpful for, whether it's effective over the long term, and potential side effects. Now, one common question that pops up is whether ketamine is an opioid. The answer is no. Ketamine is not an opioid. While opioids work by binding to specific receptors in the brain to dull pain, ketamine operates through a different mechanism. As I mentioned earlier, it affects the NMDA receptors in the brain, which play a role in how we perceive pain. Like any treatment, ketamine won't work for everyone and isn't without its risks. It is important to be aware of potential side effects. Some patients report feeling disassociated or detached from reality during the treatment. This is often described as an out-of-body experience. Other side effects can include nausea, dizziness, and increased heart rate. These effects are usually short-lived, but they can be uncomfortable. Also, ketamine is not recommended for everyone. For instance, the American Academy of Pain Medicine states that ketamine should be avoided if a patient has severe or uncontrolled heart disease, severe liver disease, elevated pressure within the skull or eyes, is pregnant, or has mental health problems linked to psychosis. It's also important to consider the setting in which ketamine therapy is administered. Ketamine therapy should always be conducted under the supervision of a qualified healthcare professional, preferably in a controlled clinical environment. This ensures that any adverse reactions can be promptly managed. So, we've covered the medical uses of ketamine, but there's another side we need to talk about: its use as a recreational drug. On the streets, ketamine is often referred to as Special K or K. In recreational settings, ketamine is used for its dissociative effects, which can include hallucinations and a sense of detachment from reality. While some might seek these effects for a temporary escape or for the sensation of euphoria, the risks are significant. Recreational use of ketamine can lead to a range of harmful effects. In high doses, it can cause severe disassociation, leading to what's known as a K-hole, a state of extreme detachment where users may be unable to move or communicate. Chronic use can also lead to serious health issues. One of the major risks is bladder damage, known as ketamine-induced cystitis, which can cause pain and difficulty urinating. Long-term use can also lead to cognitive impairments, memory loss, and mental health issues such as anxiety and depression. Recreational use also carries the risk of addiction. Although ketamine is not physically addictive as some other substances, psychological dependence can develop. People who use it may find themselves needing to take larger doses to achieve the same effects, which increases the risk of overdose. Additionally, because recreational ketamine is often obtained illegally, there's no guarantee of its purity. It can be mixed with other dangerous substances, further increasing the risk of adverse effects and overdose. So, to wrap things up, ketamine and esketamine are poised to be powerful tools for both pain management and mental health treatment. Their unique mechanisms of action make them effective for rapid relief of depressive symptoms and pain. However, it's crucial to be aware of the risks and to undergo treatment in a safe, supervised setting. And remember, recreational use of ketamine can be dangerous and lead to serious health issues and addiction. As always, if you or a loved one are considering any new treatment, consult with your healthcare provider to discuss whether it's right for you. Ketamine and esketamine therapy aren't a one-size-fits-all solution, but for many, they offer a new lease on life when other treatments have failed. I hope you found this discussion on ketamine and esketamine informative and useful. If you have any questions or want to share your experiences, feel free to reach out to us at www.drugfree.org. Until next time, stay healthy and take care.